I'm going to present case distinguishing congenital versus acquired optic disc based on OCT finding. So the first patient, male patient, 45-year-old, has come for a regular examination. His vision in the both eye was 6.6 with intraocular pressure of 16 and anterior segment was quite a normal. So when you see his fundus picture in both the eyes, inferior temporal area, you can appreciate a white defect along with the inferior RNFL defect. So over this area, so we have done an OCT of this optic nerve. So when we run the OCT over this defect, we could appreciate a deep excavation involving the NRR. So corresponding to that area, we could also see an MRW thinning with an early RNFL thinning. So this patient, again the posterior pole analysis shows loss of a papillomacular bundle corresponding to that site with an associated GCL loss. As patient was not willing for a field analysis, we took an Hood map. Hood map is nothing but it will predict the probability of a field defect based on the present GCL loss. So the field defect was involving the papillomacular area. So this is a case of an bilateral congenital optic disc pit. So second patient, 48-year female old patient, she has been treated as a normal tension glaucoma with intraocular pressure of 18 and anterior segment was quite a normal. So when you see the fundus picture, right eye shows 0.7 cupping with an inferior RNFL thinning and the left eye shows around 0.8 cupping with a more widened RNFL thinning. So when you have a closer look, inferior pole, you can appreciate a grayish slit-like defect. So when we took an OCT at this site, so when we run over this particular site, so have a close look, there is a discontinuity in the NRR corresponding to this defect. So in the similar site, the MRW shows more deeper thinning with the corresponding RNFL with a complete loss of a GCL involving the inferior quadrant. So the field defect shows deep scotoma involving the fixation. So this is a case of a normal tension glaucoma with a left eye acquired optic disc pit. So optic disc pits are nothing but a solitary gray-white excavation of the optic disc. So congenital occurs as a result of an inadequate closure of the embryonic fissure. Acquired, you will usually seen in a normal tension glaucoma. Etiopathogenesis usually due to an ischemic cause. It also indicates that there might be an past the site of an Drans hemorrhage. So congenital can be an unilateral or bilateral in 15%. In OCT, you can appreciate this well-defined deep excavation. Acquired, the excavation will not be this much shallow compared to the congenital one. So the site will be again in inferotemporal, whereas acquired corresponds to the either a superior or an inferior arcuate fibers. So when you see the MRW and RNFL thinning, in a congenital, it will correspond to the papillomacular bundle, whereas here it will correspond to the superior or the arcuate, superior or inferior RNFL. So usually congenital patient acquired this optic pit will be asymptomatic. Some complications like serous detachment, retinoschisis have been reported. In acquired, they will develop a deep scotoma involving the fixation. So thank you.